Well, Staff Sergeant Conahan, first of all, I'm intrigued by the whole, I guess, the structure of the motorcycle gang organization. The Vikings were a subsidiary of the Hells Angels. How does that work?
Essentially, somewhere along the line, someone has to reach out to the Hells Angels and indicate to them that we want to become members of your group. And it's not an overnight process. It's usually several years in the making. And they start them off, I guess, very slowly, and then there's a progression of steps. The first would be, their sanctioning, of course, and that they're allowed to wear their colors. So nobody in the biker world is even allowed to wear the colors red and white unless they're sanctioned by the Hells Angels.
Is it fair to say the Hells Angels are a multinational corporation?
Oh, absolutely. The Hells Angels are international in scope. They have chapters throughout the world, thousands of members in different countries. There is the Hells Angels, the motorcycle gang that everyone sees and fears, but there's a corporate side to the Hells Angels as well. So they have the Hells Angels Corporation that licenses and patents the Hells Angels calendars, Hells Angels sweaters, t-shirts, rings, other jewelry and whatnot, and they rigorously enforce their copyright and patent violations. So if someone were to make knockoffs of Hells Angels patches and whatnot, they would have their legal department basically go after them.
Let's come back to, I guess, the local angle here. You broke up the Vikings last week. What type of activity were they involved in on behalf of the Hells Angels?
Certainly the homicides were one part of it. The criminal organization part of it mainly centered around drug trafficking. And as you can see right in front of us here, there was cocaine that was seized, there was hashish that was seized, prescription pills in the form of oxycodone. We also had benzodiazepines, zopiclone, and as well as fentanyl. And of course, that was something that I talked a little bit about because fentanyl is so dangerous a drug that I didn't even bring it out for the display that we had for the media. We try to minimize the amount of handling that we have with it because it's so dangerous.
We've seen what fentanyl is doing in other jurisdictions. I think immediately of British Columbia.
Yes.
What's your sense as to how much of it is trickling into Newfoundland and Labrador?
Well, certainly we're seeing it sporadically. We've seen fentanyl for about 3 years now, and we're not seeing a whole lot of it, but we are seeing it sporadically. We're seeing it in all different forms. So we're seeing it in the transdermal patches that are prescribed by physicians, and some of those are getting diverted to the street. We're seeing it in the powder form, which we have seized in this investigation, as well as we're also seeing it in the form of counterfeit medications. So there are counterfeit OxyContin pills that are making their way to the street, and that's quite dangerous because if the person is an OxyContin abuser, they're certainly looking for the effects from OxyContin, but because of the profound effects a minimal dosage of fentanyl can have on them, causing respiratory depression, possibly slipping into a coma and death. And I used the example last week. The context is 3 grains of table salt could be a fatal overdose.
Who steps in to fill the void now in Newfoundland and Labrador now that the Vikings are off the streets?
This was one big step that we made in the arrest last week, but certainly there's other intermediates, shall we say. So the bikers control a lot of the distribution of the drugs. There are other organized crime groups that are also involved in the distribution of drugs, and some of that certainly, I'm sure, filters down to here. We'd be naive to think otherwise, but they insulate themselves. So they have a number of intermediates who act in between, basically to protect themselves from prosecution.
So lots of work left to do.
There are lots of work left to do, for sure.
Steve Conahan, thanks for talking to me.
Thank you.